It is, let me try to go a little bit higher. There you go. Now you can actually see the top of my head. So I do want to welcome Dr. Andrazik this morning as well, and certainly our team with Dr. Lindquist, Michelle, Lacey, and Dan, and all the folks that are behind the scenes that make sure that we have a successful briefing. So again, we know that we're in the midst of this pandemic, and that means that we have so many reasons to both celebrate the fact that we are still together, but we want to make sure that we are doing things safely. We continue to focus on vaccines as a Department of Health. As you know, that our progress for vaccines is critical as we protect not just our healthcare system, but also protecting the most vulnerable within our communities. And we really want to underscore the message from yesterday that Governor Inslee, myself, and Dr. Juchin presented, which is that we are certainly seeing some hopeful numbers when it comes to our case counts across the state of Washington, not everywhere, but across the state of Washington. And what we want to do is continue to emphasize the message about the importance of vaccinations and the importance of the protective measures that everyone needs to and continues to be able to take. As you know, we started the 2-week pause in reopening. That means that we are going to continue at the current phases for the counties that they are in. The counties that are in phase 2 will remain in phase 2, and the ones that are in phase 3 will not, will either remain in phase 3, or will not be returned to a lower phase. We know that reopening is what all of us want to do, and so this is really balancing the best we can based on the fact that we have hopeful numbers, and Dr. Lindquist can talk about those numbers in a bit. We still know that not enough people are fully protected throughout our community, and we also know that we are fighting this variant concern that the faster spreading variants have become the dominant strains throughout the state of Washington as well. So these are things that we're balancing. We're balancing reopening, we're balancing vaccinations, we're balancing this race against time, and we're also balancing COVID fatigue. And we know that our community members are incredibly, they've done an amazing job, but are incredibly tired of all these different preventive measures that we're all required to take to be able to protect ourselves and our loved ones. I want to start with some numbers as well. We've had over 408,000 confirmed and probable cases of COVID-19 in our state, and we have now over 5,500 deaths. As of April 16th, as I mentioned, our modeling is showing that immunity has lowered transmission, but transmission is still worrisome for us. And as you can see in this chart here, there is this real hope that we have as you start to see the flattening, and you might even be able to argue that it's a little bit of a dip at the very end as we get closer in time. And so we're hopeful that is the beginning of an end to the fourth wave. But again, we don't know that, and I want to caution everybody that it's oftentimes too soon to be able to predict if that is the case. We absolutely know that there is continued regional variation, and we know that case counts have been increasing in many of our counties across the state. As you see, the epi curve may be starting to level off statewide, but that does not mean that in certain communities that is 100% the case. So we want to make sure that our community members are remembering that this is ultimately about them and ultimately about their ability to fight this pandemic and do what they can. Even though we're in a pause, it does not mean the pandemic is over by any stretch of the imagination. The pause gives families and individuals a chance to get vaccinated, to continue to drive down the case counts, while we at Department of Health, along with our partners across the state and in our local communities, continue to review data. We want to make sure to emphasize prevention measures, the 3 W's: wash your hands, watch your distance, and certainly wear your face coverings, your masks. And then we want to make sure that people remember the importance of testing, that if you have been exposed to somebody who's COVID positive, or if you have symptoms of COVID, we want to make sure that you are availing yourselves of testing. Testing is available throughout the state now. There is no reason that you cannot get tested. We want to emphasize that. And certainly everybody knows the precautions that they can take to protect themselves and their families. So, we are seeing signs that immunity is slowing the spread of the virus. As you know, I shared this last time that if you're above the age of 65 and older, and you are vaccinated, we know that you have a markedly reduced risk of being hospitalized. And last week I mentioned that it was a 9.7 times increased risk if you are unvaccinated, a senior 65 years of age or above, the risk of being hospitalized for COVID-19 versus somebody who is 65 and over who is unvaccinated. Remember, we're trying to continue to reduce the strain on our health system, and we are doing everything we can to make sure that our health system is robust and we have adequate capacity within our system. So, the estimate of how many people are actively infected, what we call prevalence, was increasing and close to the third wave level as of April 16th, but the hospital admissions have not been increasing to the same extent. And we do know that that means that vaccines are blunting the effect, and that is absolutely critical. The age group most likely to be vaccinated is seeing lower cases and hospitalization rates despite overall increasing trends. And so again, this is referring to those who are 65 years of age and above. 70% of people in that age category are vaccinated. And that is the only age group where case rates are not increasing. Hospital admissions are flattening amongst people who are 60 years of age and above, and yet we're seeing increases in other age group. So what does that mean? That means that seniors are increasingly vaccinated. That means seniors are increasingly protected. And that means seniors are increasingly not as much of the proportion of what we're seeing in the hospitals as we were seeing previously. That means that we have done our job with seniors. But our attention continues to focus not just on seniors, but on all Washingtonians who are eligible for vaccine. And as you know, we're now hearing and hopeful that we are going to see Pfizer vaccine eligibility being reduced to ages 12 through 15 at some point as early as potentially next week. So we are really focusing on populations throughout all demographics throughout the state of Washington. Vaccination progress means that more than 5.5 million doses of vaccine have been given out, have been administered in the state of Washington. And I want to thank all of you and all of our partners for helping us with this. More than 82% of the vaccines that are delivered within the state of Washington are have been administered, which is a testament again to the excellent work of all of our team members on the ground. More than 30% of the state population is fully vaccinated, and more than half of our state's eligible population has gotten at least one dose. That's 55% of those who are 16 years of age or over have at least gotten one dose. I want to emphasize again the three-legged stool. We are continuing to remain hopeful for supply. And I do want to say that our vaccine supply remains limited. We are not for the foreseeable future seeing an increase. We do believe that hopefully that is going to increase over time. We are focusing not as much on administration goals as we are focusing on the fact that we need to continue to vaccinate as many people in the state of Washington. Why is that? It's because the supply is the real concern, continues to be the concern that we have, and we have, as we're having several discussions with our federal partners, we have not seen that supply is going to be increasing in the foreseeable future, although we do have some hopeful news that there will be some flexibility that the federal government is going to be giving states, but again, that there's more to come on that. If we maintain our April pace of vaccinations through May and June, about 50% of our total population could be fully vaccinated. But again, that means that we have to continue our April pace. And that is also with this three-legged stool. Remember, it's the supply, it's the logistics, and it's vaccine demand. We absolutely have the capacity within the state of Washington. We have met our goal and our metrics and all of our measures for the ability, the logistics of being able to administer a far more amount of vaccine than we have right now, be either the supply for, but we also have to recognize that it's about demand as well. And demand is a concern for us at the Department of Health, and we have been spending the last several weeks working on a number of different initiatives behind the scenes. Some of those are public service announcement campaigns, some of those are media campaigns, some of those are media buys, some of those are working with our community partners on the ground, community-rooted organizations, and certainly doing what we can with our local health departments, as well as our tribal vaccine partners and our private sector partners through our Vac Center, as well as our Vaccine Implementation Collaborative, so that we're all in this together. The vaccine demand equation that we are seeing across the country of seeing a softening of that demand means that we have to continue to focus on don't hesitate, vaccinate. If you are a provider and you have somebody who is eligible for vaccine, do not wait for another reason to vaccinate that individual. Reach out to that individual. We've had discussions along with led by Governor Inslee, along with our other partners, with our healthcare providers and our associations. And we know that healthcare providers are extremely important in getting people to get vaccinated. And we've asked our medical and health and other nursing and other associations to really come and work with us to get active information out to their patients, their clients, the individuals that they serve, so that they can do everything they can to encourage people to get vaccinated. We know that if you already have gotten vaccinated, you have done your job in one sense, but your job is not fully done. It's only halfway done. Your job is only done when you help others get vaccinated too. And we want you, our media partners, to really push this message to really help us get our community members to help others get vaccinated. And there are a tremendous amount of activities that have been going on across the state. I had the chance to meet with Shelley Slaughter and the Thurston County Health Department yesterday, had a chance to go to a homeless outreach activity that they had set up. And I will tell you that it's a continued work. As we get into this next phase of the vaccine efforts, it's not just about the numbers. It is going to really be focusing on those very difficult to reach, hard to reach populations. And that is going to be absolutely critical for us. And that's what we are focused on. Let me close with a few other messages, and then I'll turn it over to our team. We're working to make it easier than ever to find an appointment and to get vaccine. And I want to really, if we could show this, we have a new number for our state COVID-19 hotline with the Department of Health, and it's a very simple one. You can still use the 525-0127 number that we still had previously. But to help people, we have now introduced this 833-VAX-HELP. 833-VAX-HELP. And I think it's really important for us to get this number out to our community. If you are looking for how to get vaccinated, please go to our website, go to Vaccine Locator tool, and get that information so you know where vaccines are in your community. But if you have to pick up a phone or you just don't know who to go to, 833-VAX-HELP will get you into our helpline, will allow you to get information on where vaccines are. So I want to thank our team. for getting this phone number. It really allows people to be able to dial that number. It's obviously a free number. We want people to be able to dial that number and get information about where they can get vaccines in their community. Again, 833-VAX-HELP. We're continuing to hear from community partners that transportation to vaccine clinics and sites is an issue. And Dan Laster is going to be announcing partnership today to provide free rides to vaccine sites for those with transportation barriers through the VAC Center, as I mentioned. I want to thank, again, our private sector partners. Our team had a chance to visit with Kaiser Permanente just a couple of days ago on the ground, and we had a chance to really see what they were doing with vaccines, including walk-in clinic hours. And I do want to say that it's really gratifying to see all sorts of partners in it together, working together. And so Dan is going to be talking about transportation barriers. So let me just close by saying we need to continue to prioritize safety over the upcoming holidays or events or milestones. We know that Cinco de Mayo is today. We want to make sure people are, again, the emphasis of the message of celebrating safely, and if you can, celebrate virtually. And we really want to make sure we're emphasizing that same message over Mother's Day. And we know that that's obviously this coming weekend. And certainly right after that, we're going to have graduations and Father's Day. So do something for your mother, do something for your family member, do something for your neighbors, do something for a coworker, and certainly do something for your community by encouraging that individual to get vaccinated and truly help us fight this pandemic. Again, we are in a pause when it comes to our roadmap to recovery, but that does not mean that we are in a pause for fighting this pandemic or getting vaccinated. So take it outside, keep your social circle small, watch your distance, wear your mask, wash your hands, make sure you get tested if necessary, and certainly help someone else get vaccinated. And with that, I want to say thank you to all of you. I know this is a difficult, challenging time for us, continues to be, but we are making progress, and we want to be hopeful for the future as we continue to move into the fantastic weather that Washington is offering today and beyond. So with that, Corey, I will turn it back to you.
Thank you, Secretary Shaw. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, thank you, Secretary Shaw, and good morning, everybody. I'm Michelle Roberts, and I head the COVID-19 vaccine planning and distribution team at the Department of Health. As always, I want to start by giving you an overview of our amazing ongoing vaccination efforts that are happening every day across our state. So many partners are working together. Local public health, healthcare providers, community organizations, to make sure everybody in Washington has a vaccine that is easily available to them. As Dr. Shaw mentioned, in less than 5 months, we've administered more than 5.5 million doses of the COVID-19 vaccine in Washington. Our 4 state-led mass vaccination sites continue to do great work. They've given out more than 263,000 doses of vaccine. And more than half of all eligible Washingtonians have had the first vaccine, and close to 40% of those 16 and older are fully vaccinated. That's really incredible. While I'm so proud of how far we've come, and every single person who's rolled up their sleeve and gotten this life-saving vaccine, that has helped us put us one step closer to ending the pandemic. We're so close, but we need everybody's help. And we are concerned about what looks like some slowdown in vaccination rates and numbers. So if you haven't been vaccinated yet, what are you waiting for? We are all fighting complacency, and we're all tired of this pandemic. So we need people who've been putting it off or who have questions and concerns. And maybe that's because they have challenges with earlier appointments, or they need to make sure they have the right information about the vaccine to make sure they feel comfortable getting vaccinated. So now it's all of our job to make it easy, and we have to work together to make sure we're all vaccinated. There's lots of new tools to help make it easy to find an appointment, and we are bringing vaccine to where people are at. You can, and more walk-up appointments, so where you're getting your groceries, maybe your clinic will be able to serve you when right then and there. This is really the path for us to make everybody safer and to open up our businesses and economy. So to make an appointment, it's easier than ever. You can use our vaccine locator tool on our website, or you can call our new number that was just mentioned, 833-VAX help. The federal government also just rolled out a new texting tool. You can text your zip code to 438-829 as well. So lots of ways to find available appointments. And if you get vaccinated now, you'll be fully vaccinated by the time summer rolls around, no matter which vaccine you get. If you get J&J today, you'll be fully vaccinated by Memorial Day. We all know how fantastic summers are here in Washington. We want people to be able to celebrate the 4th of July and have barbecues with family and friends without distancing or wearing masks. We want to be able to send our kids to summer camp or sports camp and know that they are protected because they're old enough to get the vaccine or because those around them are already vaccinated. You can do that now. On top of that, fully vaccinated people can travel within the U.S. without worrying about testing or quarantining. If you have questions, we have a website devoted to life after vaccines. Just head to lifeaftervaccine.org. And soon, even more people could be eligible for the COVID-19 vaccine. The Pfizer vaccine could be authorized for kids as young as 12 as soon as next week. As a mom of a 12-year-old, I could not be more excited. I'll have peace of mind that she's protected when at summer camp this summer or out at sports camp or just the ability to be with friends more safely. As you likely know, Pfizer is currently the only COVID-19 vaccine authorized for 16 and 17-year-olds. Expanding to younger teens will help us protect our kids in the classroom and when they're spending time with friends, at sports practices, and much more. Next week, the Advisory Committee on Immunization Practices is going to discuss this topic if FDA does expand the emergency use authorization for Pfizer vaccine for 12 to 15-year-olds. The Western States Scientific Safety Review Work Group will also meet to review the data and make recommendations. As soon as we have any updates, we'll share them with you. Finally, I want to update you on our vaccine allocations. Next week, we expect to receive just under 400,000 doses of vaccine, which includes nearly 220,000 doses of Pfizer, more than 160,000 doses of Moderna, and close to 17,000 doses of the Johnson & Johnson vaccine. For the first time, our forecast from the federal government shows us consistently receiving the same amount of vaccine every week through the end of May. This information helps with planning and scheduling and using our new need-based vaccine allocation approach. We will work to ensure vaccine gets to people quickly and equitably where it is needed most, while also providing extra doses to providers who are seeing a higher need for the vaccine. It's important to us that the vaccine is conveniently available to everybody, no matter where you live or where you work or where you do your grocery shopping. So visit the vaccine locator to make an appointment today, and together let's end this pandemic. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Director Dan Laster.
Thanks, Corey. Good morning, everyone. As you know, the VAC Center's goal is to bring the best of resources, capabilities, innovation of the private sector to partner with the Department of Health and the public sector so that we can achieve mass vaccination of all Washingtonians in the most efficient and equitable way possible. To date, we've really focused on the issues relating to finding appointments, making it easy to find appointments. Those who aren't connected can call the call center. I'm delighted that we are now focusing our effort on making it easy for all Washingtonians, regardless of resources, to get vaccinated, including breaking down barriers relating to transportation. And we have several new partnerships that I'm really delighted to announce today. First, and these will effectively begin on Monday, the 10th. First is with Lyft, through a partnership with National United Way, teaming up with Lyft, teaming up with our call center. Individuals who are resource constrained can call our call center and obtain codes for Lyft rides and also for Uber rides. In addition, and there's our new number, 833-VAX-HELP. So Lyft is now partnering with us, and we're really excited about it. And in addition, we are also partnering with Uber. And with regard to Uber, I'm delighted that we are also partnering with CMAR and their community health centers, and also 6 other sister health centers, including Country Doctor Community Health Center, the Yakima Neighborhood Health Center, the Peninsula Community Health Services, Health Point, International Community Health Services, and Unity Care. All of these frontline providers to those in our state who are most in need, and some of whom are resource constrained. Through those providers, the patients will be able to get rides through Uber. So the exciting thing is some of the barriers that have been preventing some of our Washingtonians from getting to a site, getting vaccinated, we're moving those to the side. In addition, we did announce in March our partnership with both Sound Transit and also Pierce Transit. And on both of those mass transportation systems, anyone who's going to an appointment can ride free. So we are trying across the state of Washington to reduce the barriers and make it a level playing field for all Washingtonians to get vaccinated. Another piece that Michelle Roberts referred to, and Dr. Shaw has also referred to, is the issue of the ability to walk in rather than have appointments. Obviously, it's better and it is much more organized, and then you have the certainty of when you're going to get vaccinated. But what I'm excited to encourage is a Lyft driver, an Uber driver, other drivers, a family member, driving a friend, a neighbor, anyone who's driving someone to an appointment. In many of the sites across the state, those drivers can walk in and get vaccinated. So what this does is it really, through these partnerships, we're creating a win-win. We all want to get as many Washingtonians vaccinated in as easy a way possible. And through these partnerships, we are going to achieve it. The last thing I want to just note is, and I don't have details to announce yet, but we are also, through the public-private partnership, working with our private sector business partners to explore incentives. For different Washingtonians, there are different barriers, but our goal is to make it so that all Washingtonians can get vaccinated, so that we can all get back to doing the things with our friends, families, in the way that we were before this pandemic. And so again, I really want to thank all of the partners extraordinarily who've been working with us on different pieces of the puzzle, what I call the vaccine ecosystem of Washington. But I am delighted that thanks to our new partnerships, we're going to make it easier for all Washingtonians to get vaccinated. Thanks so much.
Thank you, Director Laster. Next, we'll go to Dr. Michelle Andrasik.
Hello, I want to thank all of you for welcoming me into this space today. My name is Michelle, and I use she and her pronouns. I want to take this opportunity to acknowledge the land that I sit and occupy today as the traditional home of the Duwamish, Tulalip, Muckleshoot, and Suquamish tribal nations. Without them, I would not have access to this working, teaching, and learning environment. So I want to take the opportunity to thank the original caretakers of this land who are still here. And Feliz Cinco de Mayo to all of those who celebrate. I think it's really important to underscore that across the United States, there are communities that are socially vulnerable. In these communities, there are higher rates of unemployment, lack of insurance, as well as higher rates of disease outcomes like diabetes, heart disease, HIV, and other sexually transmitted infections. And the relative lack of resources in these communities really impacts the ability to prevent human suffering and further financial loss when faced with additional challenges like COVID. Because of longstanding social, economic, and health inequities, These overlapping socioeconomic and health conditions, also known as syndemics, disproportionately impact areas with higher percentages of Black, Brown, Indigenous, and people of color. In Seattle and King County, for example, the zip codes with the highest social vulnerability are largely clustered in South Seattle, areas with the higher percentage of BIPOC individuals. And these vulnerabilities create situations and circumstances that have not only increased the risk for COVID infection, hospitalizations, and poor outcomes, but the disproportionate impact and burden of COVID in BIPOC communities means that these communities also bear a greater burden of loss and grief at a time when they are largely disconnected from family, friends, and community who can provide support. In addition, these communities were among the hardest hit when during the past year, the unemployment rates across Washington state soared to 3 times what they were before COVID. This created additional strains on available resources and increased stress and anxiety. The significant rise in the cost of living, lack of affordable housing, and gentrification mixed with the economic impact of COVID have led to a critical increase in individuals experiencing homelessness. Homelessness here in Seattle is considered to be a crisis. Again, BIPOC individuals are disproportionately represented among those experiencing housing instability, particularly our Washington State Native and Indigenous and African American populations. Native and Indigenous people comprise about 2% of the Washington State population, yet they represent over 15% of individuals who are without housing. And African Americans, who comprise about 4% of the population, represent 25% of Washingtonians experiencing homelessness. We also know that women who are pregnant, postpartum, miscarrying, or experiencing intimate partner violence are at especially high risk for developing mental health problems during the pandemic. Additionally, parenting is often substantially more stressful, and I can speak to this myself as a parent, particularly during the pandemic, and women are disproportionately responsible for the bulk of domestic tasks, including childcare and often elder care. The stress in parenting in many studies has been shown to be greater for employed women or single parents, given the additional challenge that we are experiencing now with homeschooling. Although many of our children have gone back to school or in hybrid situations, there are still homeschooling challenges for many parents. And I think it's important to note that the number of children and teenagers seeking help for anxiety or depression during the pandemic is rising across the country. A recent study by the Centers for Disease Control and Prevention, the CDC, found that the percentage of children ages 5 to 11 seeking mental health care at emergency departments in 2020 increased by 24% from 2019. And for children ages 12 to 17, mental health related emergency visits increased by 31%. Another study published in July 2020 examined the impact of COVID-19 school closures on the identification of child maltreatment victims. They found that in the context of financial, mental, and physical stress due to COVID, and we would think that these things would likely result in additional child maltreatment cases. What we have found is that the number of reported allegations is about 27% lower than expected, indicating that child maltreatment is not only underreported, but also underaddressed. And I think it's critical that we realize that in order to mitigate the negative emotional and mental health effects of the pandemic, we will need to proactively reach out to disproportionately impacted populations to enhance social support and to ensure that communities have the resources they need to cope effectively. Efforts to dismantle systemic racism and to foster equity in health, social, and economic systems are needed and vital to mitigate the inequitable risks posed by pandemics and other times of healthcare stress. So, proactive outreach and the enhancement of social supports could not only lead to prevention, but also early detection and prompt treatment of mental health challenges and symptoms. And critical to all of this is social support and access to quality services. These are both key protective factors. And I'm really proud to be a Washingtonian because Washington State is one of the national leaders in the equitable distribution of vaccines. We have achieved this, as many people have stated before me, by strengthening community partnerships and building capacity. We will need these same approaches to ensure the health and well-being of our communities moving forward. Thank you again.
Thank you, Dr. Andrasik. This brings us to the Q&A segment for today's briefing. With that, let me pause just a moment, switch my screens. Our first question comes from Ariel with the Spokesman Review.
Thank you. I have two questions today. The first is, what does herd immunity being out of reach or difficult to reach mean for Washington State residents in terms of things like mask mandates, reopening phases, or just the rest of this year in general? And then my second question is, if we have more substantive data on which variants in Washington are causing more severe COVID cases or increasing hospitalizations. Thank you.
Thanks, Ariel. For probably a few months, and Dr. Lindquist and I were at the Fred Hutch Center, so it's interesting that we have a guest from there. We had spoken about the importance of using the term adequate vaccine coverage, and that's what I've been using for the last few months related to this concept of herd immunity or not herd immunity. In fact, I oftentimes don't use that terminology. I use adequate vaccine coverage. What we're really trying to achieve is to make sure that we have enough vaccine coverage so that you lessen the risk to individuals who are most likely to have a negative consequence, but also that you have a situation where you are able to limit the amount of outbreaks or the significance of those outbreaks. So a number of things that we're trying to do to get that adequate vaccine coverage number. Now, I will say that there has been a lot that's been made about, quote unquote, herd immunity. And as you know, that a lot of national public health folks have come out with saying that, well, 65-70% is, they've either said it's not achievable or we don't know if that is the right number. And so, folks are really trying to get to a point where, they're trying to recognize why it's so critical that we have enough people that are vaccinated. What we're doing is behind the scenes trying to look at our data and trying to do some projections and seeing what a good number is. We know that it's at least half of our population, but how far it goes above that, that's what we're really working on. But I'm shying away from the use of the word herd immunity and really talking more about adequate vaccine coverage. Now, you do know when folks do use that terminology of herd immunity, it's a combination of those who have been either previous infections with COVID in addition to those who have been vaccinated. So just adding all that in. So I think over the next week or two, we're going to have some additional information as we do some calculations behind the scene. As far as your second question, let me turn that over to Wist. Actually, he may have a comment about the herd immunity question as well.
Yeah, thanks. No, I think you handled the herd immunity question well. I think the real answer is every vaccine makes a difference, and certainly for every individual. So if I get vaccinated, I'm protecting my patients, I'm protecting my friends, I'm protecting my family. So that is probably the single most important message, is every single dose counts. As far as the genotyping goes, for the month of March, we did 13% of all positive samples were genotyped through a series of labs, both labs we contract with in the private and the university setting, as well as the public health lab. And that's 4% overall since the beginning of this pandemic. That makes us one of the highest genotyping states in the country. And I think that is really going to help guide us. And I think the message today from our genotyping is that the B117, which is the most common variant, is about 47% of all our genotypes currently. And again, remember, we're looking at isolates from several weeks ago because it takes that long to get them and get them genotyped. So it likely has changed, and we'll follow these trends. But B117 clearly is the highest number, and that's the UK variant. And what had been previously the biggest variant percentage-wise is now down to 23%, and that's the 429, which is one of the California variants. And the one to watch, though, is P1. All of these have increased infectivity, some effect against the vaccine, but they are all controlled by the vaccine. So I don't want us to feel that there isn't control of these variants. And that P1 has gone from 5% in the era of the B117 being so predominant to double that to 11% currently. So that is really the one to watch, the P1. And of course, we know British Columbia is having a large number of P1 percentage, and that's where we're at. There's no real trends coming with this that are concerning, meaning is there excess death? Is there specific area of the state that's more common? And it is found in almost every county of this state, and we're not seeing any specific trends right now that are going to guide any change in action. Back to you, Corey.
Our next question comes from Jessamine with Q13.
Good morning, and thank you again for taking my question. Yesterday, we learned a little bit of a pause in the roadmap to recovery, as you mentioned, but each time these have been evaluated, we've seen a change. And I guess in 2 weeks from now, it wouldn't surprise a lot of people if we saw another metric change. I'm wondering, even though I know you'll be working in conjunction with the governor, if you could give me your medical professional opinion on whether a vaccine metric might be something that you would support being added if there are new metrics made, just considering that we're continuing to see the population get more heavily vaccinated.
Jessamine, thanks for that. And, you know, to clarify, I think we're always giving our medical and public health opinion. So just to let you know.
I didn't want you to think you were speaking for the governor. That's all I meant.
Got it. Just wanted to clarify. We've had internal discussions at Department of Health, and the team that's on this call right now, we actually have a strategy discussion on a weekly basis where we talk about our vaccine strategy and, everything from the outreach activities, what we're doing with our partners, what are some of the challenges or opportunities that are there. So that's happening weekly. And one of these discussions we've actually talked about with metrics, does it make sense to bring vaccines in? One of the real concerns with that, and first of all, we haven't landed anywhere, Jessamine, about whether or not it makes sense or not. We have seen, for example, what Michigan has done with its reopening. They have a vaccine metric that's tied in, and we know that other states are doing that. We're constantly and continually having these discussions with other secretaries of health and other departments of health across the country as well. Is that in the state of Washington, it's really hard to tie in a vaccine metric by itself. Because yes, we're trying to encourage as many people as we've talked about throughout this press conference to get vaccinated, while we're also very mindful of protecting the healthcare system, which was that ultimate goal, while we were also working on the metrics previously. And then in the midst of all that, we're trying to find the right metrics that allow us to do that. So it's a long way of saying, Jessamine, that it's a complex equation. And my medical public health opinion is that you can go both ways on the vaccine side. Absolutely, do we believe that vaccines are the roadmap to recovery for all of us? But in the short term, do you tie the metrics of particular reopening milestones to a vaccine goal, especially as you have limitations on supply and you have limitations on demand? That's the part that's really hard to judge. That's why we haven't come to a final, if you will, decision or a conclusion point of this. But that's our really issue. It's complex, and whether a specific milestone in a roadmap allows you from a statewide standpoint to say that, we should go in this direction or not go in that direction, that's where we haven't fully landed. I'm just trying to be as authentic and honest as possible. So yes, we've had the discussions. Yes, we're looking at what other states are doing. Yes, we're having our internal review and calculations, but we haven't landed on whether or not that's going to specifically help us with either with recovery or if it is going to be helpful or not as helpful when it comes to our vaccination efforts. Jessamine, before we go to the next question, it was a pretty intense answer to a very important question. So let me give you a moment to, if you have a follow-up. Does that answer your question?
Yes, in a way. I was wondering if you and if Scott would support that as being a safe thing to add to allow opening up more. If that would help counties open up, would you support it?
If that would help counties open up, would we support adding vaccine metrics to reopening?
Yes, or do you think that would be premature? I guess in your first answer kind of nullifies your ability to answer the second.
Well, only because the supply and the demand equation is the piece of it. So I'd like to have a better recognition of what's happening on the supply side from our federal side, but also on the demand from our community members. We've seen the softening of the demand, and so we're trying to figure out how much of that is really governmental, how much of that is truly what's something else that's happening within the community. So that's where it's a little bit tricky of saying that we should absolutely add that kind of a metric. But we are absolutely looking at it. And if you have ideas on how you think would be a fair and equitable system, please share. Scott, did you want to add anything?
No, I think you covered it well. I got to be honest, I'm not as worried about tying it to a metric as I am interested in doing whatever it takes to improve vaccination across the state. It's not really about the metric to me. It's about really meeting people where they are and making sure people understand the value of vaccination. And let's do that rather than tying it to the metric. I'm not officially opposed to that, tying it to a metric. And Umera said it well. We're discussing it for sure. We haven't come to any conclusion, but I am much, much more interested in getting people access to the vaccine and improving.
Thanks, Jessamine. Corey?
Our next question comes from Steve with Como.
Hi there. Thanks for taking my questions this morning. I have two questions for you. A number of cities and counties across the state have now opened up vaccination sites and clinics to basically anyone without an appointment. I know DOH said last week that on a statewide level, demand is still outpacing supplies based on the doses that providers are requesting and how much the state is getting from the federal government as part of its weekly allocations. When on a statewide level do you expect supplies to start meeting demand? Are we getting close to that point yet? And what accounts for some of those areas seeing such an influx of doses in the past couple of weeks? My second question focuses on people getting vaccinated. So looking at the state's dashboard, it appears that we're starting to see some clusters of counties that are kind of lagging in terms of how many people are fully vaccinated. It looks like parts of like Northeast, Southwest, Southeast. Why do you think that's happening? Is it a matter of allocations for those counties not having a direct pipeline to the federal government? And how can the state address that?
Yes, Steve, thanks for that. I'm going to actually ask Michelle or Lacey if they want to comment on this. Either of them can take it. I will say that, yeah, we are close and getting closer, and which is, you know, on the one hand, it's a good sign because that means the supply at some point will increase, or at least it'll be where we need it to be. But it is also not a good thing because, I mean, let's be honest. We are seeing the softening of this demand in parts of Washington, and that is a concern. And in the Puget Sound area, we have still, from our local partners, they're saying that, you know, there's interest, there's robust interest in getting vaccines. And as you get more and more appointments that are available because supplies are there, then, you know, obviously that starts to stretch the system. And while the capacity is there to deliver well over the vaccine numbers that we can right now, we just don't have the supply. But when that supply is there, now you're going to start to get that demand be increasingly the real limiting step, or that third leg of that stool. That's the short leg. So I do think that's something that is a very it's different in certain parts of the state than others, right? So in the larger urban areas, you're seeing more of that demand. At least it's being masked, if you will, because you have so many people that are still there that are interested in getting vaccines. When you go to some of our smaller jurisdictions or more rural jurisdictions, and we've had these conversations over the last several weeks with our local health partners, they're saying that, look, in some areas that we've kind of hit it, and we're not going to be able to do a lot more. And so we're trying to give as many resources, as many, you know, any technical assistance, as, you know, whatever we can do to help. And that includes even the mass fact sites that we had put in place. Now we're looking at shifting to even mobile outreach activities that we've already been doing, but to enhance those activities. So there's a lot that goes into this, but it does appear that we're getting close, but we're already there probably in some communities more than others. And I think that's the key message. Lacey or Michelle, did you want to take on the second part of the question?
Yeah, I just want to add that this is the first week where we're seeing ordering less than what our allocation is. There's probably a lot behind that we still need to work on. We have some providers who still have never gotten COVID vaccine who are registered with the state program. So we have a lot of outreach to do and continue to make sure people know that they have vaccine available and they can order, because for a lot of time providers were ordering and having their orders denied. So we've got some follow-up work to do. We definitely have plenty of vaccine right now with our stable kind of allocation from the federal government for any provider that wants some. And also we're kind of in a transition too, for working towards having more vaccine in refrigerators so that when somebody comes in, there is vaccine available and they can make that offer. And that's part of our work to make sure vaccine is accessible where people are. And that's a transition from when supply was so extremely limited that we had to make sure we were getting it to the places that had the highest throughput, and it was pretty limited. So we're in a big transition here around vaccine supply and have a lot of work to do. Some of the things Dr. Andrasik said is some of the communities that are most at risk because of social economic factors or other lack of social supports. They really need, it's our job with our community partners and local public health to make sure vaccine is accessible and easy to get. So because people who are working multiple jobs or maybe don't have transportation are not going to be able to get long distances or travel long distances to vaccine, or maybe don't have time off work. And so those are the types of problems we need to continue to solve to make sure everybody who has an opportunity to be vaccinated, especially our communities at most at risk. And I think as far as communities with lagging rates, we need to continue to work with local health and community partners to figure out what are the barriers. Is it questions and concerns? Is it lack of access? How do we get mobile teams in there? How do we switch some of our strategies from kind of maybe stand-up mass vaccination clinics to more mobile-based clinics? How do we work on things like Dan said about free transportation to vaccine appointments? Those are all the strategies. How do we have community partners help schedule appointments or have pop-up clinics at their community centers or at churches? So those are the ongoing strategies. That is really the work we have to do to reach what is still a gap of people who are saying they want to be vaccinated in our state. Our polling data still says our state has one of the highest people who want to be vaccinated or open to being vaccinated. And like we said, we have over about 50%, getting close to 55% of the eligible population who has started vaccine. And now we need to continue to close that gap for people who still want to be vaccinated.
Let me also just say that, look, we have made it from a public health standpoint as a country. We have put those tools in place. They are now there. Our community members know what those tools are. It's wearing your mask. It's all the 3 W's. It's getting tested. It's making sure you're avoiding the larger crowds. We know indoors are worse than outdoors. Dr. Duchin talked about indoor ventilation yesterday. We know that vaccines are a tool that's available to anybody right now 16 years of age or above. And the tools are there. It is now up to people to avail themselves of those tools. We've been at this now for 4 or 5 months of doing everything we can to remove barriers, to get vaccine supply up, to make sure the capacity is there to meet our goals that we've been setting on a daily basis or a weekly basis or a cumulative basis. We've done everything we can think of, and now it's really about people getting vaccinated. And at the end of the day, we can do as much as we can to incentivize, and we're absolutely doing that as well, or working behind the scenes to work with our private partners and our public partners and seeing what else we can do. But it's really ultimately up to our community members. And we have to recognize it is up to our community members in order to make sure we are successful with this. This is all about everyone together. And unfortunately, if we don't work together, then we will not achieve the vaccination coverage that's going to be adequate to continue to fight this pandemic in the way that all of us should.
We have 3 more reporters in the queue for today. So our next question comes from Nicole with Cairo.
Good morning. Thank you so much for taking my question. Could you tell me what percentage of Washingtonians who are getting either Pfizer or Moderna are skipping their second dose at this point? And if you have any idea why people are tending to skip that second dose?
I'll let Michelle do the number specific. I will say that, we are hearing from our providers, sometimes people are just forgetting that they have a second dose that they need to do. There's confusion that they need a second dose. There's some confusion about J&J's 1 dose, the other 2 or 2 doses. People think they're forgetting. Sometimes people are just misplacing the appointment times, dates, and then thinking that mistakenly, well, if I've already missed it, I can't go back. And so there are a number of those omissions that are happening where people are incorrectly thinking that the second dose is either not important, or they forget, or they've just, they've for one reason or another just not gotten around to actually getting the second dose done. We do believe that majority of people are obviously getting the second dose, and they're also, if people are delayed, then they are still contacting their provider and getting information on how they can, or how long they're able to get that second dose. But as far as specific numbers, Michelle, I'll turn that to you.
Yeah, we shared that last week at the press conference that less than 5% of people who have gotten Pfizer or Moderna vaccine are not getting their second dose, and that's compared to about 8% nationwide. So we definitely want all those people to be vaccinated. I think it often potentially is confusion about scheduling your second dose appointment and when the instructions may be coming from the provider. So that's a piece of it. We do have people who are traveling across the state sometimes and maybe want to get their second dose elsewhere. So you can use our vaccine locator tool to schedule that second dose appointment or call the 1-800 number. Those are in, we can help make those pieces easier if you're not clear about how to get your second dose. And I do think there's some level of timing of people thinking about when they want to schedule their second dose, just knowing they may have side effects for a day or two. So I think that's at play as well. But we are doing a lot to make sure we're reminding people who are missing their second dose and asking providers to help us as well, make sure those people get a reminder and know they need to come back in to be fully protected.
Our next question comes from Steve with King 5.
There we go. I want to ask this question. Clearly, vaccinations are key to moving forward. It's clearly the message from the Department of Health, from the governor's office. Yesterday's press conference with the governor weighed very heavy on vaccinations and actually talked about a fourth wave plateauing. But then later in the day, we saw this release from the Department of Health, which said that the fourth wave is here, and went into specifics about the hospitalizations and deaths being up, specifically among younger people, talked about the variants being up as well, and just kind of painted this dire picture. So I'm trying to get a better sense of what the messaging really is here. Is it that we're on a good track and vaccinations are getting us there, or that things are pretty serious still?
Yeah, let me turn that to Dr. Lindquist, Steve, only because he has a hard stop in just a moment or two here, and then get his thoughts, and then I can just add anything that he wants that he may not say.
Yeah, I think that it was really subtly presented when Umair presented the data. I don't know if we can put the epi curve back on the screen here, the one that shows the most recent data. So, Steve, I think the official language about, yes, we're at elevated rates is based on the metrics, and a reminder that those metrics are looking at data up through about a week ago on average, because the data isn't complete. But what we showed with that metric earlier, hoping someone can put that epi curve back up, Corey. And that shows in the incomplete data where we've done this peak. So the answer to the question is both. Yes, we've gone through increased rates of hospitalization and cases, but you can see these gray bars in this epi curve are incomplete data, but it appears to have a plateau here in our most recent data that aren't included in the metrics measures. And that shows a downward trend. Now, that's not complete data. We're giving you a preview of data that we looked at from this last weekend, and that's where you're hearing this message of there may be a plateauing or even a downward turn in this data. We are cautiously optimistic about it, but doesn't negate the fact that we are in a fourth wave, that we are at high rates, higher than our second wave, and it's concerning. Hospitalizations are up. Now, there's some fine detail to those hospitalizations. They tend to be younger people, and they tend to be shorter stays. So all of that is a very complex message, and I don't think you can just paint with one brush stroke of it's good or bad, because it's both.
And just the only thing I would add to that, Scott, is that as you see in the close insert here, there is some complete data that shows a few days where the trend is also coming down. So it's not just the potential in the gray, but also in the light blue. I just wanted to point that out. But Scott is absolutely right. Right now, it's an important message, and we are watching this as closely as we can on a daily basis to see where numbers are, where what's happening across in different communities, and certainly cases as well as hospitalizations. All of that is something that we're focused on, because we don't want to see the increase. What the concern we would have, and why Scott is right, is what we don't want to see is that we start to see the plateau and decline, and then you see a jump up. And so that's why we're watching this closely.
Our final question comes from Paige with the Seattle Times. Due to audio issues, I'll be reading the question on her behalf, although she is tuned in to hear your responses. So, the question is, how will the Biden administration shift to reallocate doses affect Washington?
Yeah, that's a great question. I'm going to ask Lacey to jump in and answer this one as well. What I would say is that from our standpoint, that again, that shift is welcome news, because it allows for flexibility. And just as we are looking at a demand-based approach across the state, which means that we still have trying to flow vaccine throughout the state of Washington, there are going to be certain communities or certain sectors where we see that there's more demand and to push vaccine there. That's a very similar thing as what the federal government is also doing. And so, again, haven't seen that all play out, but that is something that we are absolutely watching with them, and have had conversations both with our federal partners, but also with our fellow health secretaries across the and departments of health across the country to see how this is going to be operationalized. But that flexibility is welcome. Lacey, did you want to add anything?
Briefly, we don't have a lot of specific details on how this will roll out. As Dr. Shah mentioned, conceptually, it seems very similar to the pivot our own state made about a week or so ago, in terms of a combination of ensuring that all states have access to order. Just as in Washington state, all counties have access to order to ensure we cover the map, the geographic map, and then those doses that aren't claimed by states become available to states that need more vaccine. So, this is basically a pivot that's happening nationwide. We saw it here in Washington state. We're seeing it in other states. We heard that other states hit this transition even before we did. And, from our perspective, it helps get vaccine to where it's needed across the country within our state. And we'll keep you posted as we learn more about the specific details.
Thank you. This concludes the question and answer segment of our briefing today. And now, I'd like to go to Secretary Shah for closing remarks.
Again, I want to thank Dr. Andrazik for joining us, and certainly our team for being a part of this briefing. I want to thank all of our media partners, as always, for everything you're doing. We are in the grind every single day, and we know you are as well. And so we just want to appreciate your efforts to get the messages out and communicate to our communities across Washington. I just a reminder again, it's Cinco de Mayo, and as people commemorate that, we want to make sure they do so safely. We know Mother's Day is coming up this weekend. We are also wanting everybody to do so safely. And ultimately, it's about our loved ones. And, we talked about this yesterday at the press briefing with the governor, that if you do not get vaccinated for yourself, if you don't believe that it's important for you to get vaccinated for yourself, we would ask you at least to get vaccinated for your loved ones, or to protect your community. And that is really the key message from us, is don't hesitate, vaccinate, but also to be kind and remind others to get vaccinated. Do everything you can to help them. I want to thank all of our partners that have been working with us, our especially our local public health partners who have been just so fantastic throughout this entire pandemic, and our public and private sector partners that have come together. We had some exciting announcements today with transportation, and so thank you to our team for that as well. And again, just a reminder of our number, the 833 VAX help number, and we want to just continue to emphasize, we want to make sure that appointments are easy and people avail themselves of that. So with that, thank you so much, and we'll pick it up again next week. Corey, back to you.